Ladies and gentlemen, good afternoon. We're a few minutes late. I apologize for that. We need to make sure everything is ready. Now we're starting the press conference for Iroquois County residents to update on the situation of COVID-19. Just so everybody knows, all of our attendees are by invitation only, so we can make sure that social distance guidelines are practiced. Everybody's 6 feet away. If we come within 6 feet with each other, we all have our face coverings available. So, without further ado, good afternoon. My name is Eric Stacey. I'm with the Iroquois County Emergency Management Agency. The Iroquois County Emergency Management Agency is dedicated to ensuring prevention, protection, response, recovery, and mitigation of the COVID-19 pandemic. To that end, EMA's objectives have been to support the local health infrastructure and enable the first responders. EMA activated the Emergency Operations Center on the 16th of March 2020 with an in-person meeting of all community partners. After this initial meeting, the EOC has remained active, hosting virtual meetings over conference call and webinar every day for 4.5 weeks, and now 3 days a week for 3.5 weeks. The community partners involved in these meetings include the Iroquois County Public Health Department, Iroquois Memorial Hospital, long-term care facilities, EMS, fire and police departments, 911, workforce development, Chairman John Scher, and numerous other organizations. These meetings give all players situational awareness and allow agencies to bring forth issues or questions for collective responses and solutions. One large task of EMA has been focusing on is ensuring partners have the resources they need, specifically personal protective equipment, or PPE. To date, Iroquois County has received 10 shipments of supplies from the state of Illinois. Some of these supplies were requested by EMA, and some of them were pushed out by the State Emergency Operations Center. EMA has received a donation of alcohol antiseptic from Whiskey Acres Distilling Company. In addition, EMA is hosting a PPE donation drive at the Iroquois County Youth Center every week on Wednesdays from 9 to noon. Between these supplies and stockpiles ICPHD and EMA already had on hand, we have logged 120 resource exchanges. As close of business Monday, we have distributed the following supplies to other agencies, which include the hospital, medical providers, long-term care facilities, emergency responders, and other critical infrastructure agencies. 10 coveralls, 15 face shields, 400 gloves, 1,750 goggles, 450 gowns, 13,972 hand sanitizer packets of the size of a ketchup packet, 636 pints of alcohol antiseptic, 141 infection control kits, 1,055 N95 masks, 439 KN95 masks, 6,425 surgical masks, and 11 thermometers. The pandemic is inflicting travesty on the whole world, now associated with now killing millions, or 264,679 deaths globally, and 1 in Iroquois County, associated deaths. We are far from finished with this disaster, and the only way is through. These conditions understandably create dread and anxiety in our hearts. The hope can be found in the actions of our medical staff, emergency responders, food providers, cleaners, and other critical workers that are working to keep us safe. EMA is proud to serve these people and provide them with the essentials they need. As we move forward, EMA will continue to provide for the preparedness and response for COVID-19 so that we can recover safely. And now I'd like to present Iroquois County Public Health Department Administrator, Deanne Scher.
Thank you, Eric. As of May 7th, 2020, Iroquois County has 84 individuals with laboratory confirmed cases of COVID-19. Here's the information that I'm willing to share about our recent cases. Case number 79 is a male under the age of 20. Case 80, number 80, is a female in her 60s. Case number 81 is a female under the age of 20. Case number 82 is a male in his 40s. Case number 83 is a female in her 50s. And case number 84 is a male in his 30s. Of the 84 individuals with laboratory confirmed cases, 22 have recovered and been released from isolation by the health department. 6 individuals, as of today, are hospitalized. 55 of these 84 individuals remain isolated at home. Let me repeat that. 55 of them remain isolated at home. Some of those individuals are very ill, even though they're at home, while others are completely asymptomatic. So we know that we've discussed this in the past, and that this virus is manifests very differently for different people. A lot of that depends on comorbidities or underlying health conditions. But for each one of these individuals, the illness can manifest very differently. We also have one person included in the 84 that have tested positive who has passed away. And we extend our prayers and our deepest condolences to the family, the friends, and the community members who were affected by that loss. Every death is a loss that's mourned by someone. No additional details will be provided regarding any of the Iroquois County residents per compliance with 77 Illinois Administrative Code 1005. A link to this administrative code is always provided in our press releases and will give you further information regarding the collection, disclosure, and confidentiality of health statistics. So basically, it will explain to you why we can release certain information and why we can't. For zip code level information on confirmed positive COVID-19 cases, please visit the IDPH virtual map. The link can also be found in our press releases for the IDPH virtual map. Press releases are published on the Iroquois County Public Health Department Facebook page and on our website. So I will say a little bit about the zip code cases. So the Illinois Administrative Code is very specific about counties with specific populations and what we're allowed to report and what we're not allowed to report. Zip code information found on the IDPH virtual map will only occur for smaller counties with as small of a population as we have, once those cases are greater than 5. So greater than 5 means 6. So once we hit 6 cases, then you will find those numbers by zip code on the IDPH site now. For information on long-term care facilities with cases of COVID-19 among residents and staff, you can also visit the IDPH map. Again, this link can be found on each one of our press releases. And you are able to search each county, and in that information will provide you with which long-term care facilities in that county have cases and how many cases that they have. The IDPH website also does say that that information will be updated weekly. So there's going to be some lag time. So I searched late last night when I got home from work. So probably about midnight, I searched just to see if anything new had popped on there. It still only lists 2 cases. And we, know that number has a possibility of increasing at any time. So with that being said, it's going to take a few days before they have the opportunity to update that. Okay. So when state statistics and county statistics don't match, The one thing I can tell you is that we update our numbers every day. And they're the most accurate, current numbers we can provide to you on our press releases. So our numbers are almost always going to be larger than what you're going to see on the IDPH map site. So IDPH reports the numbers that we give to you in our press releases report congregate data. In an effort to clarify that, I do want to explain just a little bit. A confirmed case is an individual residing in Iroquois County who has a positive laboratory confirmation of COVID-19. The total confirmed case numbers we report includes all individuals who have tested positive, regardless of their current status. So even if they're recovered, this number will never decrease. In an effort to be transparent, we want to provide you with as much information as we can. So we've had a public outcry. There are a lot of people that really want us to take off the recovered cases off of our case count. That's not how statistical information works. It doesn't work that way. And we assume that people can take the number of total cases because we're providing the number of recoveries. We're assuming that people are able to come up with that number if they want to know how many quote unquote active cases. Now, I don't like the term active. I've been very clear about that. Active is not necessarily the appropriate term. A better word would be people who have not recovered. Okay, for lots of reasons. But I want you to know, what I want the public to know is that our nurses are working tirelessly. We are doing disease investigation on every single one of those people who has been laboratory confirmed as a positive case of COVID. We are also contacting every single known identifiable contact that meets certain criteria with that person, and we contact those people as well. Iroquois County Public Health Department will place people who have tested positive under isolation. We will place the direct contacts of those cases under quarantine. So we isolate the ill and we quarantine the exposed. I want to make this very, very clear. At no time, ever, does the Iroquois County Public Health Department quarantine the general population or the public. People are confusing quarantine with the gubernatorial stay-at-home order. But the health department only isolates or quarantines those people who we know and can prove are a risk to the general population. But at no time do we quarantine the general population. Okay? So my nurses are very, very busy doing investigations, disease investigations, contact tracing, mitigation and control efforts, calling people. Those people are monitored every day while they're under isolation or quarantine. Someone will be released when they meet the specific criteria that we have in order for them to be released. But please know that those efforts are diligent, and our nurses are working very hard to protect the general public. So let's talk a little bit about testing. As you know, yesterday was the first day in a press release I gave testing numbers. Let me talk to you a little bit about that. First of all, when we began receiving test results, testing at that time was only done on hospitalized people. So the first test results we got in were for people who had been hospitalized. Shortly after that, they opened up testing to those people who had specific signs and symptoms of COVID-19 illness. So for several weeks of the testing protocol, what would happen is once someone either went to their doctor or went to the hospital and was ill enough that the doctor wanted them tested, the doctor would call the health department, and the health department would then review that criteria and give an authorization code for testing. That authorization code for testing meant that that test could be sent to the Illinois Department of Public Health Laboratory to be tested. Because in the beginning, we know that just the 3 IDPH laboratories were doing testing. So that meant Chicago, Springfield, and Carbondale, where the IDPH laboratories are. Since then, since that time, testing criteria was opened up to different people. Then it was people who were exposed, and then it was healthcare workers, and so incrementally, as testing has been opened up to more and more people, and at the same time, while more and more facilities began testing, because shortly after the IDPH labs were the only entities doing testing, then the reference laboratories like Quest Diagnostics or LabCorp or Alverno Clinical Labs, reference laboratories started doing testing. And shortly after that, hospital labs started doing testing, and now private labs can even do testing. So as testing has opened up, we're not just testing the ill anymore. So I didn't give out numbers. I want to explain to you that I didn't give out numbers in the beginning because almost everyone that was tested positive because they were the people who were ill, and that's all they were testing. But as it's opening up now, and testing is available to more and more people, as we get more test results, we're getting a clearer picture of that as we're getting more negatives than positives. So that's gives us an idea of what the ratio is. So that's important to take that factor into consideration. Something else that I'd like for you to think about is the fact that positive test results are reportable to your local health department within 3 hours of test validation. But because that is a state requirement, doesn't mean that it's happening. There's a huge backlog in testing, and it's taking us much longer than 3 hours to get test results. So, and then usually the positives are reported before the negatives for the day, so then the negatives take even longer. So, we're trying to be understanding with entities as they're reporting to us at the health department, but please know that it's taking a lot longer than 3 hours to get test results. From the laboratory or from the hospital where they were tested. The other thing to keep in mind is that the number of tests does not always equal the number of people tested. So let me explain that for a second. We have many people in Iroquois County who have been tested more than once. Some of them have been tested more than twice. So it's important to remember that not every test means that it's a different person being tested. Does that make sense? Let me say that again. The number of tests does not equal the number of people being tested. So that's something to keep in mind as well. And then yet another factor for consideration, and I think this one's pretty important, is that even if someone is tested and they test negative, that negative test result is only valid at the time of specimen collection. So once the test was performed and put into a vial and mailed off to a laboratory, and it takes however long to get through the mail, and arrives at the laboratory and gets logged in there and sits for a while before it's tested, and then it's tested, and then it takes them a while to get that information entered into INES, the Illinois National Electronic Disease Surveillance System, and then it gets reported back to us. That can take a long period of time. During that time, anyone could be infected. So let me put it another way. If you were tested on a Monday morning and I don't get your lab results back until Friday afternoon, does not mean you are still negative, because you could have gotten infected, even though you were tested Monday morning, you could have gotten infected Monday afternoon. So I don't think it's an unreasonable projection to say that some people whose test results come back negative may not be negative when they're given those results. So let me summarize that one more time this way. You were only negative at the time the specimen was collected. You cannot be sure of your status beyond that point, beyond the point of collection. Make sense? Okay, so with that being said, I'm going to give you today's numbers. So keeping all that in mind, as of today, at approximately 2 o'clock, Iroquois County Public Health Department has received 504 test results for COVID-19. Of the 504 results, 420 have been negative, and once again, 84 have been positive. So about 16.6% of our testing has come back positive at this point in time. I want you to know that this is a rapidly evolving situation, and the Iroquois County Public Health Department will provide updated information and guidance as it becomes available on our Iroquois County Public Health Department Facebook page and our website. And at this time, I'm going to ask the Iroquois County Public Health Department Medical Director, Dr. Phil Zumwalt, to come up, and he's going to talk to you a little while. Thank you.
Yes, hi. Today I thought I would review some of the facts we know about and present a few new information that's come out in the last few weeks. As known, the coronavirus is a large family of viruses and is known to circulate among people at times. It also has been shown to be in animals such as camels, cats, and bats. And this is now known to evolve where it then can spread to people and then spreads among the other people as this pandemic has. The ones that we've known before are the SARS and the MERS, which have been also severe respiratory illnesses. As known, the symptoms seem to appear within 2 to 14 days: fever, cough, shortness of breath to the point of needing oxygen or possibly a ventilator, as well as headache, muscle ache, sore throat, and another unusual finding is the loss of smell and taste. The new information that's come out is it also may be causing some clotting disorders in the blood, has led to strokes and heart attacks and pulmonary emboli, where some of the people that seem to be getting better on the ventilator then relapsed and died, and it's looking like it was pulmonary emboli that was causing the secondary problem. This virus, as known, is spread through sneezing, coughing, and is an aerosol and lasts in the air for many minutes. Important to know that you are shaking hands and touching other people, you can spread it that way, and the virus will stay on other objects for a period of days. And so it's very important that you wash your hands after touching anything that possibly could have been exposed. As known, you should wash for at least 20 seconds. And always avoid touching your mouth, your nose, or your eyes because this is how it can get into your body. There have also been rare instances where it is spread through fecal contamination. So the treatment has evolved over the last few months as this disease is still being studied and learned about. To begin with, we just had taking pain medicine as well as fever medications, resting, drinking plenty of fluids. The latest things that are still preliminary but being studied are using serum from COVID recovered patients that have antibodies that can be transfused into a very ill person. There's some hope that this will give us some relief. And then also an antiviral drug, Resdesivir, is being studied and has some hope this may improve the situation. In the meantime, we just have to wait until we get a vaccine that hopefully will help settle this whole epidemic down. Thank you.
Good afternoon. Over the past several weeks, there have been individuals speaking forth to question the authority of Governor Pritzker to issue his most recent executive orders. In some cases, these same individuals are advocating that individual counties and health departments should repudiate the governor's orders and then to shut down, open up, resume business as it was. The problem with this approach is that it's not legal. Counties and health departments only have the powers and authority granted them by Illinois statutes. Nowhere does it state that county boards and/or health departments have the right to override or the authority to take actions in direct violation of state and federal laws and orders. Some have said the county board should instruct the health department to disregard the governor's orders. Same rules apply here also. The county board has no statutory authority to set policy for or to tell the health department what to do. The issues that have been raised shall rightfully be decided by the Illinois Supreme Court. With that being said, all of us are tired and bored with the shelter-in-place order. We want it to end. We get that. We recognize that many local businesses are closed and others are suffering the loss of revenue. Well, you can count Iroquois County government in that boat too. The county expects to sustain a serious loss in revenue this year as a result of the shutdown. While law enforcement and other essential county services will not be affected, there will be some adjustments made in how business is done. For now, the administrative center and highway departments will remain closed to the public. All government functions are being maintained, however, and those desiring county services are asked to contact the appropriate department to arrange an appointment or other means to transact their business. Contrary to a statement printed recently in a local newspaper, county business should not be directed to any one county board member. All county departments are functional and available for county business. So one may ask, is this worth all the sacrifice and inconvenience just to keep the virus from spreading? And maybe most will get it anyway unless the treatment and vaccines are found. Each one must answer that for himself, but also ask the committed healthcare worker and first responder if it is worthwhile as they go day after day, many times working 16 and 18-hour shifts as they face the virus straight on with their patients with whom they are committed to help. All the while knowing the odds of them contracting the disease are not in their favor, And some have done exactly that, even here in Iroquois County. Ask what would things be like today if back in early March the governor had said, I can't act because it isn't clear that I have the authority to take action. There are many difficult questions to ponder, but perhaps the most important, what will happen if we go back to normal too soon? Will there be a large uptick in infections and deaths? Is restarting the economy more important than managing the pandemic? Is there a way to do both? Restart the economy and manage the pandemic. On Tuesday of this week, the governor announced a new plan called Restore Illinois. Most everyone has heard about this plan by now. I want to take a few minutes, however, to touch on the highlights. The plan divides the state into 4 regions and has 5 phases through which each region is supposed to navigate separately in order to return to normal. Iroquois County is located in the central region. At the present time, we are in phase 2 and are not likely to enter phase 3 until May 29 at the earliest. It is important to note that the ability of Iroquois County to enter the next phase is dependent entirely upon the combined performance of all counties within the central region. It is also possible for a region to regress back to an earlier phase if certain criteria are not met. In conclusion, I want to thank the citizens of Iroquois County for their cooperation and patience as we work together through this crisis. Your use of good judgment and common sense have stood out, and it is inspiring to have the support of the people we serve. By working together, we will conquer this challenge. And with that, we open to your questions.
Hi, Brendan Benson with WCIA.
Excuse me, sir, please turn on your microphone.
Oh, it's on.
Switch is on the top. Thank you.
Hi, Brendan Benson with WCIA. I see here that some adjustments will be made in how business is done. Is Iroquois County considering furloughs of any county workers at this time, or still funds?
Nothing has been decided, so I guess in a sense you could say everything is on the table. But there may be some of that. There may be other areas in which some adjustments can be made, but obviously we have to make adjustments. You don't necessarily need to direct your questions just to me. Any of the other speakers are available also.
I don't know if you can release this yet, but with the ages of most of the recent outbreak, is it safe to say that many of those were at a nursing home, knowing that the state will take a while to update that website?
I'll go ahead and answer that. Unless you want to answer that, John. Go ahead and take it out. So if you look at the IDPH site map, and we provide that link on all of our press releases, and you look at, go to the long-term care site, you may only see 2 cases. But if you would go to the IDPH site and look at the zip codes, that will give you the answer to that question in a roundabout way without me having to tell you. We're not trying to hide statistical information. I want to make that very clear. We're providing it, but we're also trying to respect the privacy of the individuals who test positive, which is so important to us. I've worked myself for public health for 28 years. No one can ever say, Deanne Schubert said so-and-so has chlamydia. We take all of the staff at the Iroquois County Public Health Department take huge pride in the fact that we do not disclose any kind of personal information. We take people's privacy very solemnly, very reverently. We take it very seriously. And we don't judge people. You know, we work with the public every day. We don't place judgment, and we don't want to ever be in a situation where we're putting people's information out there so other people can place judgment on them either. It's just something that we're never going to do. But if you're good with numbers and you are good at putting puzzles together, all of that information is always in our press releases. You may just have to read the press release very diligently and click on some other links, and that will lead you to additional information that will answer your question.
I have two questions.
Okay.
Okay, so I want
Are
to
they
go
for
back.
me?
I think so.
Okay. If they're all, I'll pass them off.
I want to go back to, earlier you said that in some cases people might have been tested more than once. Can you explain why that would be?
Sure. So let's say that you are a healthcare provider. Let's say that you're a doctor in Iroquois County, and you come into contact with numerous people. And let's say you get a sore throat, and maybe the sore throat doesn't have anything to do with COVID, but you're going to want to make sure before you start seeing other patients, right? So you'd be tested. Then let's say, a week or two later, you were seeing patients, and someone in your family got a sore throat. You might want to be tested again to see if you're the asymptomatic carrier. So there are lots of reasons why someone would want to test somebody. The other thing is that some employers are requiring their employees to have, and usually this is healthcare entities, but some of them are requiring not for health department protocol, but for their own agency's protocol, that the person have 2 negative tests before they come back to work. So if that's the case, then that person's going to be tested twice. So there are lots, and there are more reasons than that people are retested. There are also cases where somebody might see a physician. The physician might send them to a local hospital to be tested. They're tested, it comes back negative, but then 3 or 4 days later, their symptoms get really bad. So the physician might want them tested again, just to make sure that it wasn't too early in the process, that it didn't show up. So yeah, there are lots of reasons why somebody would be tested twice.
I think that's happened where somebody's been tested a couple times and then finally that was tested and it came back positive.
Yeah, that happens. Yes.
I have one more question.
Sure.
Do you have, or can you tell us how many of the 84 positives have been asymptomatic?
I don't have that exact number, but I will tell you this. I can get that information because we contact these people, whether they're in isolation or quarantine. They're contacted every day. So we know exactly who's symptomatic and who's not. I can tell you that in the beginning, over the last month or so, as we've been giving case numbers, everybody was sick because only the people that were sick were being tested, remember? So everybody was sick. Now that the numbers are expanding for testing, we are seeing more and more people who are asymptomatic. And there are definitely people who test positive who are asymptomatic and absolutely have no signs or symptoms whatsoever. And that's even a little more dangerous than people think, because those are the people that are walking around and don't realize that they have it and spreading it to people who then can get it and become symptomatic. So, it's a very big concern for people. It is. And if you're somebody who has a comorbidity or an underlying health condition, and you're considered someone who's vulnerable, someone who's on chemotherapy and your immune system is low, people who have autoimmune diseases, anybody that has a lowered immune system is a vulnerable person, and those people are fearful. When we first remember when we did our first press conference, and we get saying to you, don't panic, people, don't panic. We don't want the public to panic. We still don't want the public to panic, which is one of the reasons I didn't release those first numbers, because, if 50% of the people that are tested are positive, that scares people. They don't realize that all of those people were only tested because they were sick. So we're not trying to hide or manipulate numbers or not give you the full picture. We're trying not to scare the public. one of the things that many people may not realize is that the health department has investigated communicable diseases forever. That's one of the things that we do every day normally, even when we're not in a pandemic. If we get a salmonella case, we investigate that case. We contact the case's contacts. We go through food histories. We fill out pages and pages of disease investigation information to try to prevent the spread of salmonella through the public. Okay, that's our job to do that. Normally, you don't hear about those things because it panics people. And we would never want to have the public be afraid. That is the exact opposite of what a health department does. What we actually really do every day is we do all this work behind the scenes to keep you safe so you're not afraid to go out in public, so you're not afraid to live your life. That's what the health department does every day. And a lot of people don't realize that. So when I say don't panic, don't panic. And we are working very diligently. And I do think that the isolation and quarantine, the prevention and control measures that we've implemented with people is helping to slow down the spread of this virus, which is what the whole point of all this is to slow down the spread. We know typically that if you can slow down the spread of a virus, as viruses transfer from person to person, many times they'll get weaker. And that's a good thing. So if you can slow down that spread, you may end up with a weaker virus 2 months from now. We also know, on the other hand, the opposite can be true. If viruses spread very rapidly, you're going to see rapid mutation, and that's not a good thing. So, there are lots of reasons that public health officials are so diligent in our investigations. For the people who are on isolation or quarantine, sometimes I'm sure they sit on the other end of the table or the other end of the phone, and they think, why are you asking me all of these questions? Why do you need to know every detail of everything? Because that's how we put pieces of puzzles together, and that's how we prevent the spread of diseases. We're always looking for, where did you get this? Where did it come from? How can we stop it? All those things. It's a complicated process that I can't go over in just a short period of time, but we work very hard to keep you safe. Do you have another question? You said you two, or did you cover them? Carla had two? Oh, yeah.
If a person is tested, they live in Iroquois County, but they're tested in another county, where do those test results go?
That is a great question, because we get that question a lot. All communicable diseases that are on the Illinois reportable disease list, you can find that on the IDPH website. Just Google Illinois reportable disease list. It's a big chart that'll come up. It'll name all the diseases that are reportable by law to your local health department. I'm not sure that they've actually put COVID on there yet, but we know it's being added. And we know that behind each disease, there's a little parentheses that tells the time frame in which that has to be reported to your local health department. So with the Illinois reportable disease list, those things are reported to your local health department through a system called INEDS, Illinois National Electronic Disease Surveillance System. INEDS is a great system. It's been around forever. Every day when my nurses go into work, they open that system, and we can see everybody that's tested for everything. You can see who's got chlamydia, gonorrhea, who's got chicken pox, anything that's communicable. But the system is only as good as the person inputting the data. So let's say that you go to an Iroquois County resident. Let's just say that they go to Kankakee to be tested, and they're tested in Kankakee. That data, the identifying data that goes along with that test result, so the person's name, age, date of birth, address, phone number, all that stuff is put into INEDS. There's also a place that they have to click for county. It happens sometimes that people click the wrong button. It happens sometimes that that they'll fill out an address but leave the city blank. So then a lot of times those laboratories will put their own county in. It's assuming that it's probably one of their own people. And it may take a day or two before the county health department realizes this is not our case and transfers it to us. So those things happen. But to answer the question, Carla, always when someone is tested and that data is input into INETS, it's put into to the county that is listed as the person's home residence. Yeah. Is it for me, Brendan? Okay.
I apologize if this is really something that you can't answer, but I just want to throw it out there.
That's okay, you can ask, and if I can't answer it, I won't.
No, totally understandable. So, can you say or whatever if like, any local nursing facilities, if they're just following the recommendations of at least the county health department?
Yeah.
Like, I'm just asking if
That I
they're
can
fully
answer.
cooperating, basically.
They are very much cooperating. All of the local, as Eric Stacy explained at the beginning, he has an EOC meeting, an Emergency Operations Center meeting, and local long-term care facilities are participating in that meeting 3 days a week. I'm on that with them. You guys can't imagine how hard they're working to make sure that they're doing everything possible to prevent the spread of COVID-19 in their places. They're requesting extra equipment. They're talking back and forth, sharing ideas. They're asking for guidance all the time. Our local long-term care facilities are working their tails off to try to prevent the spread of COVID in their buildings and with their residents. These people love the people that they care for. They do. Trust me when I say that, because you don't work in long-term care unless you love your residents. So they are working diligently and trying and making every effort. But this is still a virus that is passed from person to person, and it's going to happen. And it does not mean that long-term care facility did anything wrong. Nobody's perfect. And certainly none of that's intentional. Nobody wants that associated with their facility. Nobody wants that. And more than anything, nobody wants a death in their facility. I can guarantee you that.
Thank you.
You're welcome. Doc has a question.
I was gonna say, part of our job, I think, is to promote a healthy amount of fear of this virus so that everybody will socially distance and wear their masks. And
Very
so when
true.
they say we don't have any fear, I don't think that's quite right either. We need to have a little bit of fear of this virus.
That's a good point, Doc. Absolutely. So for those of you, Doc didn't have a microphone in front of him and he's got a mask on. He said that one of the things is it's not always a bad thing to promote a little bit of fear, to make people fear a virus so that they adhere to the guidance that they're given. And he's right. So when I told you earlier, we don't want you to be afraid. What I should say is we don't want you to panic. But absolutely, this is something that can definitely be detrimental to somebody's health. So obviously people fear that. Yeah, that's a good point, Doc. It's important to clarify those things. It's easy to stand up here and give you facts and figures because I assume sometimes that people know information and can kind of read our minds, and that's not true. So yeah, anytime you hear me say something and you think it needs to be rephrased a little bit, please do so. I don't have any problem with that at all. I make mistakes every day too, just like everybody else.
One more.
Yeah.
Are you able to say out of the 6 who are hospitalized, if any are in intensive care? I know the state sometimes gives out numbers like that.
No, I'm not going to comment on that. The state can give that information out, but that's not something I can tell you that, yes, there are people in intensive care. I just won't give you a number.
You can say that.
But I can say, oh yes, I can say that we have people in intensive care. Absolutely. Any other questions?
maybe before we're done, and we've got some information up here, I don't know if any of you have any questions about any of that. One thing I was gonna point out is these are the regions in the governor's restoral law order. This is Iroquois County right here. Geographically, we're in the biggest area or region in the state. And that, I'm not sure whether that's gonna be a problem or not, but time will tell. It's an area that's obviously largely rural. There's a few larger cities like Champaign and Springfield and whatnot in there, but that's where we're at. Until some change is made, if any change is made.
If I may comment one more thing on that, Mr. Chairman. To the left of the map is graphics that are available on IDPH's website. That data was as of the 5th of May. This is data, statistics on the central region as the Restore Illinois plan put out by the governor's office states certain qualifications have to be met for each region to move into the next phase. And those are some of those metrics of where the central Illinois region stands as of the 5th of May. Over here on the right is a chart that I've been doing. Been taking publicly available statistical data on the confirmed case numbers. And this is what it is in Iroquois County as of end of day yesterday. This does not include today's numbers. The blue line, here we go. The blue line is the confirmed cases. Below that, the orange line, no, the bottom line, the gray line is pretty hard to see. Those are our deceased. The red line is the cases that have recovered. And the orange line between blue and red is the amount of cases that are remaining. So just to give you a brief snapshot of what's happening in your Iroquois County. And to get pictures, of course, we'll let you come up and take pictures after we're done. Any further questions, comments? All right, folks. With that being said, we'll adjourn for today. Thank you very much for attending in person and online. Everybody be safe.